PKD stands for polycystic kidney disease. It is a disease that damages your liver and is inherited through genetics.
So polycystic kidney disease is a disease that affects about 12.5 million people worldwide, and it's a problem with an adhesive protein that is not just found in the kidneys, and we'll see some extra renal manifestations of it too, but it most dramatically affects the kidneys, and we get these cysts on the kidneys. In this picture, you can see the kidney is completely covered, and that may or may not be the typical presentation, but it is a presence of multiple cysts bilaterally on the kidneys. And it comes in two varieties. One is the autosomal dominant polycystic kidney disease, and then the other is the autosomal recessive. And the dominant is most common, and usually is symptomatic after age 30. Half of them get end-stage renal disease by 60, and many of them get cerebral aneurysms. Then the recessive disorder, and this is kind of a common pattern that you see in autosomal dominant versus autosomal recessive. The recessive is often more severe. It's more often found earlier in life, infants and children, and these kids will almost indefinitely go into renal failure as infants, and it leads to liver fibrosis as well, and many die from this. So the presentation presents with pain, hematuria, hypertension, renal insufficiency, palpable kidneys. I got this picture here. I actually forgot who this guy is, but he's supposed to be famous. He's the only famous person I could find with polycystic kidney disease. And anyway, the extrarenal manifestations are hepatic cysts, Barry aneurysms, diverticulosis, mitral valve prolapse, and about 50% of these people have a family history. Another important note on the presentation is that many of these go undiagnosed. They estimate around 50% go undiagnosed, which is due to the wide spectrum of how severe this can be. So for diagnosis, the most common and the easiest screening test to do is an ultrasound. But you can see it on a CT or an MRI as we have here. Treatment, you want to avoid urinary tract infections because they can wreak havoc on your kidneys. You want to control hypertension with ACEs and ARBs. And in end-stage renal disease, of course, you have to resort to dialysis. So if a patient with polycystic kidney disease presents with a severe headache, what is the next best step? And what I'm getting at here is you want to make sure that they don't have an aneurysm. It's a fairly common extrarenal manifestation of polycystic kidney disease, so double check CT for cerebral aneurysm.
What does having PKD mean? PKD will cause cysts to form in your kidneys and weaken your kidneys overall. Cysts are formed through cell proliferation and fluid secretion. Cell proliferation is when a kidney cell that is affected by the PKD gene starts to divide, and it keeps on going, and then it fills up with fluid, and fluid secretion kind of breaks off and forms like a bubble type thing. This is a picture of a normal kidney, and this is a picture of a kidney that has PKD. The difference is rather obvious. When the kidneys enlarge like this, it is very painful for the person who has PKD. Cysts will start forming in PKD1 sooner than they would in PKD2. As far as the range of severity goes for PKD, there's not much of a difference. Basically, if you have PKD, you have PKD. The only way you could have PKD and not have it affect you is if you have the recessive PKD. The reason that having PKD is such a big deal is that you use your kidneys to filter toxins out of your body. This waste is then sent to your bladder, and then it leaves the body through the urethra. Because the disorder PKD creates a protein that causes these cysts to form, it interrupts the kidney system, and the kidney ends up having to do more work, and the person, first of all, well, they have cysts in their kidneys, so their kidneys are much larger, and it's very painful, and also they have more toxins in their bodies. PKD puts a lot of strain on the kidneys, which means that people who have PKD are more prone to kidney issues. The biggest issue that they would face would be kidney stones, which is when these tiny little rock-like substances get formed inside your kidney and go through the same tract as the other toxins, so they go through your urethra, and it's a very painful process. Kidney stones, of course, are not limited to people who have PKD, but people who have PKD are just more prone to it. Because PKD affects your kidneys, a lot of people think that PKD is the result of poor kidney care, but that's just a myth, and really it is just a genetic disease. Of course, I mean, if you don't take good care of your kidneys, you will have many other issues, but PKD is only from genetics. Despite the many efforts of groups such as the PKD Foundation, there's been no cure found for PKD as of yet. The most important thing to do if you do have PKD is just really live a healthy lifestyle. Some specifics are having a regular checkup with your doctor, low protein diet, staying hydrated, a healthy blood pressure, not putting any extra strain on your kidneys such as alcohol, plenty of exercise that does not involve impact. Polycystic kidney disease affects the lives of many, and although we don't have a cure yet, if we keep on learning more about this